Bacterial vaginosis, or BV, is a polymicrobial syndrome in which the normal vaginal lactobacilli, particularly those producing hydrogen peroxide, are replaced by a variety of anaerobic bacteria and mycoplasma. The infection, characterized by poorly understood changes in the vaginal microbiota, is diagnosed using Amsel's diagnostic criteria. So why am I talking about vaginas? Well, I find it interesting and very strange that the cause of the most common vaginal infection is still unknown by scientists. Why don't we know whether or not it's sexually transmitted, why up to 50% of women are asymptomatic, and why there is a 66% chance of reoccurrence 4 weeks after antibiotic treatment? Figure 1 shows a model of the bacterial taxa associated with the 4 clinical criteria used in Amsel's diagnostic: pH, odor test, clue cells, and vaginal discharge. The stars represent bacteria represented in greater than 75% of women with BV. On the other hand, the bold print represents associations with Amsel's criteria as a composite unit. Although the etiology of BV remains unknown, vaginal intercourse, multiple sex partners, smoking, and douching have been associated with an increased risk of BV. I am focusing on the sexual risk factors. Figure 2 shows a forest plot of the association between new or multiple male partners and bacterial vaginosis in 28 different studies. The effective size is given as relative risk and shows a positive association between a history of male sexual partners and the risk of BV. I would like to mention that although I did not include the figure, the association between BV and new or multiple female partners is almost identical to the numbers associated with BV and male partners. Well, since I'm already talking about vaginas, let's go ahead and talk about condoms too. Figure 3 shows the association between BV and condom use in the same 28 studies. The estimated relative risk of 0.8 showed that condom use was protective against BV. The studies indicate that prevalent and incident BV is consistently associated with new or multiple male sexual partners and the lack of condom use. I find it kind of peculiar that, with this information and data, bacterial vaginosis is still not considered sexually transmitted. So what's the takeaway? Well, although most cases of BV don't result in severe complications, serious risks can result if BV is not managed appropriately. Bacterial vaginosis is also associated with a 40% increased risk of preterm birth and has been associated with pelvic inflammatory disease. My advice to you is to use critical thinking, pay attention to your vaginas, and don't be ashamed to ask questions. Our lady ecosystems are complex yet interesting.